The COVID-19 pandemic has created even more risk and uncertainty for vulnerable Virginians. Virginia's free and charitable clinics have continued to operate during this challenging time, serving more than 74,000 Virginians in 2020. And this year, more than 3 out of 4 clinics are seeing a spike in demand. So joining us now to tell us more is Helen Ferguson from the G. Wayne Fralin Free Clinic in Roanoke. Good morning to you, Helen.
Good morning. How are you doing?
Good. Thanks so much for joining us today. So I know there was a recent survey throughout the state about these free clinics having an increase. What are you seeing right now at the Fralin Free Clinic?
So we are seeing an increase in patient demand. And it's a good thing, we think, because we serve homeless patients, and so that means our homeless patients are looking for care. And so we're excited about the increase, but it means that we're asking more of our volunteers than we ever have asked of them. Before, for them, it was a couple hours a week or a month, and now for some of our volunteers, it means they're actually working a part-time job.
Oh, wow, that's a lot. So exactly what kind of services are these patients needing right now?
So surprisingly, there's a couple different things that they're really asking for right now. Telemedicine became really big during the pandemic. So for the patients that we serve, oftentimes they don't have privacy to do their telemedicine appointments. So we're providing space for that. And then also early on in the pandemic, they stopped seeing providers. And so we're doing a lot of medication refills and getting them back on their normal care. And then also, as every practice is seeing right now, we're actually seeing a demand for COVID testing and COVID screening, as well as vaccinations.
Yeah, and I'm curious, we were just talking about this increase in demand in COVID testing. Any issues with that so far at the free clinic?
Not for us right now in our clinic, but we've been very cautious about using our tests because we experienced early on difficulty getting tests. So we've been very cautious about using them.
Yeah, very true. I know a lot of people actually started stockpiling a lot of different necessities like the masks and the gloves, the PPE, because they were concerned about what happened at the beginning of the pandemic.
Right, and I can't say that our clinic's not one of those as well, but we have always made sure that our patients have exactly what they need. So if they're telling us they're having difficulties getting masks or different things like that, they always know they can come to us to get them.
That's wonderful. Now, you did mention that you have your doctors and volunteers working so much. It's actually a part-time job. So are you also facing a staffing shortage like many other free clinics around the state? And if you are, I mean, what can the community do to help?
So our clinic's been very fortunate about volunteers. We actually have volunteers who hadn't volunteered in a while come back during the pandemic, which has been great. But staffing has been an issue for a lot of clinics and volunteers, and so we even have a couple positions posted that we can't actually fill right now. So what the community can do is actually reach out to their local clinic if they know who that is. I know on their websites the jobs are posted, the volunteer opportunities are posted, and if you don't know who your local clinic is, it's really simple. There's a website, freeclinicscare.org, and you can find out all the staffing positions the clinics have and their volunteer opportunities.
Okay, freeclinicscare.org, certainly important. Now, I do know that a lot of experts out there, they say that they expect to see an increase in demand for a lot of these free clinics. So how are you preparing at the Fralin Free Clinic for this?
Well, we're getting ready to staff up a little bit so that we have the appropriate staff in place. And we're also looking at our scheduling models to see how we can better prepare for that. One of the things for our homeless patients that we've always tried to do is that when they come in looking to see a provider, they can see one within 24 hours. So we're really gearing up our scheduling so that we can continue that model.
Okay, well, you are certainly important to the community. Again, freeclinicscare.org if anyone wants to help out. Helen Ferguson from the G. Wayne Fralin Free Clinic, thanks so much for joining us this morning.
Thank you for having me.